Welcome back, everyone. During pregnancy, we know to avoid alcohol, maybe even limit caffeine. But now doctors say there's an entire food group that pregnant women should also avoid. Plus, the toll air pollution takes on the heart. And researchers look into why non-smokers may be developing lung cancer. Those stories and more in tonight's Health Watch. Why are a growing number of non-smokers developing lung cancer? A study by UC San Diego shows air pollution and environmental exposure are the main reasons to blame. That pollution can come from vehicles, industrial emissions, or even wildfires. The study also found that even some traditional herbal medicines are causing lung cancer in non-smokers. And exposure to pollution doesn't just damage your lungs, but your heart, too. A study published by the Radiological Society of North America found people exposed to air pollution over a long period of time had scarring of their heart tissue, which is an early warning sign of heart failure. The COVID pandemic impacted many types of diseases. A study published in the British Medical Journal shows mental health disorders, stroke, and heart disease, as well as malaria in young children, all shot up because treatment was neglected during the pandemic. Women get better at managing their anger as they age. A study published by the Menopause Society found once women reached midlife, fewer and fewer report experiencing anger issues. The results suggest that women are able to better regulate their emotions during and after menopause. Eating inflammatory foods while pregnant could raise the risk that a child will develop diabetes. A study published by the British Medical Journal looked at expectant mothers who ate inflammatory foods like red and processed meat, sugary drinks, and deep-fried foods, and found that a diet heavy in these foods can raise the risk of a child developing type 1 diabetes by as much as 16%. And doctors say older women are still at risk of developing cervical cancer caused by HPV. A study published by the British Medical Journal showed that despite younger people being at increased risk, women over 65 are still developing HPV-linked cervical cancer. Most guidelines recommend not screening for HPV in older women, but researchers say those guidelines may need to be revised. Yeah, and right now, the National Cancer Institute recommends cervical cancer screenings every 3 years for 21 to 24-year-olds, every 5 if you're between 25 and 65, and then no more after 65 if you've had regular negative tests. For a closer look, go to the feature section of our website, 2news.com, and click on the Health Watch icon.